Efficacy versus effectiveness. Many persons often get confused with efficacy and effectiveness. There is a very minute difference between the two. Efficacy is the effect in perfect conditions, whereas effectiveness is the effect in the real world. Now let's understand one by one. Definition of efficacy. Efficacy equals to best possible results for a particular intervention under perfect condition. Efficacy is the degree of success to which an intervention does more good than harm under ideal circumstances. Efficacy studies are frequently conducted in large tertiary care, which leans to have more specialized clinicians and better technical equipment than primary care facilities. These studies conducted in phase 2 clinical trial as the number of patients less than 100 to 300 with specific diseases. Now let's understand definition of effectiveness. Effectiveness is equals to most likely result for a particular intervention under programmatic or real life conditions, taking into account compliance, dropouts, withdrawals, the learning curve for surgical interventions, etc. Effectiveness assesses whether an intervention does more good than harm when provided under usual circumstances of a healthcare practice. Therefore, population in primary care may be tolerable subject group for effectiveness studies. These studies are conducted in phase 3 clinical trial where approximately 300 to 3000 patients with specific diseases. So, from the above definitions, it can be concluded as how well the treatment, intervention, drug is performed in a small population is termed as efficacy, and how well the treatment, intervention, drug is performed in real world is termed as effectiveness. When efficacy study that is performed in phase 2 trial cover a large population, then only it will be termed as effectiveness studies, which is performed in phase 3 trial, as now it will be closer to the real world.